Morning. All right. Um, for the this is the end of the 6 weeks at the end of the week. So if you have everything up through chapter 5 turned in, chapter 17 will go into the next 6 weeks. So um, at least start getting those in as well by the end of this week or the following week. Chapter 5 quiz. It's gonna be at the end of this week. I know some of y'all might be doing something on Friday as far as pep rally and stuff. So you'll just do it the following week. because it's going to be on the next 6 weeks anyways. The chapter 5 quiz will be on the next 6 weeks. We're starting up chapter 3 today. We're just going to do a quick review over chapter 5 real quick, just to make sure we're good on it. I have 3 Jeopardy labs set up here, so could help you out on as far as abbreviations. What is abbreviation for AMP? Hmm? What'd you say? Starts with ampule. Yeah, ampule. Ampule. What is ampule? All right. TAB. Tablet is correct. Let's see. This is over strength and system measurement. Let's see. GTT. Drop. Drop. See, route of administration. TOP. Topically or topical. Another route of administration. ID. Intro something. What's a layer of your skin, I guess? Oh. Yeah. Intradermally, intradermis, intradermally. Second round, here we go. CAP, capsule, ELIX. Elixir. What is elixir? OZ. Ounce. Ounce. PR. PR. What abbreviation is that? Per rectal. Or rectally. Per rectal. Per rectum or rectally. IM. Intramuscularly or intramuscular. CR. And I believe, okay, this is dosage. I'm going to say this is a dosage form. What do you apply topically? Okay. Dosage 2. LOT. That one should be easy. Yeah, lotions. GM. Measurement. Gram. I guess this is a repeat. Rectal, rectally. PR is also per rectum or rectally. INJ. Injection. Liquid. Easy. Syrup. Kilogram. Subcutaneous, or it would be SQ. Subcutaneously or subcutaneous. Intravenous, intravenously, suppository. Yeah, ointment. Ointment. Meal equivalent. Meal equivalent. Nothing by mouth and not by mouth. By mouth. All right, let's go back here. So that was the first one. You every 4 hours. I don't know if y'all have that one on you. Aqueous. It means water. AQ. AQ means water. Oh, my bad. RX. Prescription or to take. ID again. Intradermal. Intraderminously. MG. Milligram. MCG. Microgram. Intramuscular. IM. Write on label or give the following directions. Give the following directions or directions. That's the SIG is what the directions are going to say. So no known drug allergies. PRN. Huh? Somebody say it. As needed. As needed. QID. 4 times a day. The bonus that the bonus some of y'all put daily. So just make sure 4 times a day. NPO again. Nothing by mouth. QD every day. Oh, every day. Daily. Subcutaneous again. Or SQ. SC as well. ML. Milliliter. TID. 3 times a day. Let me see what the. So it's miscellaneous. I would say that's measurement. Liquid. Yeah. Yeah. Oh, that's patient. Sorry. I was thinking measurement more on that because it said miscellaneous. So patient for that one. AC. AC. Before meals. After meals. PCs after meals. IV. Intravenous or intravenously. Liter. Measurement again. Milliliter. Millimeter. Huh. I'm not for sure on that one. That's the first time I've seen that. Nasal. nasal. So it's not NOS. PC, after meals. VO. Let's see. Verbal order. Okay. Y'all won't see that. Y'all won't see that. BID, 2 times a day or twice daily. All right. Last round. Let's see. What's abbreviation? IM. What do we also call aspirin? Or it's an abbreviation for it? ASA. ASA. And y'all know potassium abbreviation? Okay. Yeah. Y'all did chemistry, didn't y'all? TID. GTTS probably. Oh, okay. GTT. GTT. MG. That's easy. BID. Will be the abbreviation. Pretty simple. Yeah. Mom. MOM. That one, I don't even know that one, I don't think. PCN. PCN. Injections. S, SQ, SC. I would accept SQ as well because that's would fall into that category. What is ID? Yeah, intradermal. Abbreviation for acetaminophen? APAP. AMOX. You won't see none of that. About before breakfast? AC. Before meal, before breakfast, AC. Every 6 hours. What's every? No, every 6 hours. Q what? Q6H. Q6H. SOL or SOLN. As needed, whenever necessary. As needed. PRN. PRN. Magnesium should be MG. That kind of would be misinterpreted for milligrams as well, huh? Iron. Nope. Fe. Fe. Ferrous sulfate is iron, right? Injection commonly used for rapid action antibiotics and hormones. See what that is. IM. IM. So this is like your azithromycin. For the most part, azithromycin. Common site used for infants and children. Ew. I don't know what VL is. That one I have to look up because I haven't seen that one. Sodium chloride? What is sodium? NaCl. NaCl. Ethyl alcohol. You won't see that. You won't see that on the test or anything. Ointment. Hung. I don't know how they got that, but deciliter. DL. All right. So those are some of the abbreviations to go over. Those are located in your Canvas. And you also have like a matching as well here that'll help you out. I'm going to start up chapter 3 this week. So again, everything up through chapter 5 needs to be turned in. So that's chapter 16, chapter 19, chapter 5. Let's see here. All right. All right. So chapter 3 consists of the different types of jobs a technician can do, the associations and settings, the different settings for a technician.
Chapter 3, Competencies, Associations, and Settings for Technicians. Quite a few terms and definitions, but we will cover them throughout the chapter. Technician qualifications and job descriptions vary from state to state. Currently, there are no mandatory national standards or requirements pertaining to technician duties or training needed. So what that means is there's no federal, national requirement saying that you have to do the PTCB or the NHA exam to become certified. Therefore, each state board of pharmacy determines the standards required and how they are to be met by technicians. So the state board of pharmacy can implement that you need a license, which most states do now, and most of those states also require that to get that license, you take the PTCB or NHA. So it's kind of required, but technically not, if that makes sense.
Both tests are nationally certified. PTCB is just a different organization. When you finish taking this course in your senior year, around the end of this month or early May in your senior year, before then, we'll be preparing you all for the NHA certification test.
Due to the rapidly changing healthcare system, the job descriptions and educational requirements of pharmacy technicians are quickly changing. Among the changes are increased responsibilities, the need for higher education, more legal responsibility, and certification mandates. This trend can be seen across the United States. Many boards of pharmacy now require completion of a program accredited by the American Society of Health System Pharmacists, which is the ASHP, for a person to become a registered technician. And of course, our program is accredited by the ASHP, which you're currently in.
We're accredited through ASHP and PTCB. So that is why that you're allowed to take these types of courses.
States require pharmacy technician certification board or National Health Care or Health Career Association certification and have accepted it as their measure of the knowledge base for pharmacy technicians. Positive aspects of these changes include a wider range of jobs available, bonuses, salary increases, and better benefits for technicians. Historically, technicians have answered to a variety of titles. These include pharmacy clerk, pharmacy assistant, and pharmacy aide. Technicians have held a variety of positions. Some of the job responsibilities have been billing, ordering, stocking medications, typing, answering the phone, greeting customers, troubleshooting, cashiering, and running errands. Technicians have been a part of the pharmacy field since the beginning of pharmacy. However, more recently, pharmacy managers and the respective states board of pharmacy have been attempting to classify and clearly define the role of the pharmacy technician as the needs of pharmacy change. So our roles are definitely different than they were 10 years ago. Our roles are definitely different than they were 20 years ago, and it's going to continue to be like that.
So we didn't used to give injections or anything like that, but that's coming to fruition because of COVID-19 and the regular flu shots that everybody gets. So you can also get injection certified to give these types of injections.
Technicians' duties focus on tasks that do not require professional judgment, but rather concentrate on their technical skills and training. Pharmacist duties have moved from filling prescriptions and compounding simple agents to counseling patients and interacting with other medical professionals such as physicians and nurses. This change can especially be seen in the hospital setting where pharmacists are responsible for managing dosing of medications and participating on committees. The change in responsibility has been addressed many times over the course of pharmacy technician history by the ASHP, the APHA, and other pharmacy associations. The need for skilled personnel has never been greater. One significant contribution to the improvement of the pharmacy technician profession was the development of the white paper. In 2002, the American Journal of Health System Pharmacists addressed many of the challenges pharmacies face by publishing the white paper on pharmacy technicians 2002. Needed changes can no longer wait. A white paper argues a specific position or solution to a problem. The paper explores the diversity of pharmacy technicians' qualifications, knowledge, and responsibilities. The white paper was endorsed by a panel of pharmacy organizations and comprehensively discussed issues pertinent to the promotion and growth of a competent pharmacy technician workforce. So in box 3.1, you can see what the white paper on pharmacy technicians covered.
That's on page 59 in your book.
In 2009, the task of pharmacy technician education and training programs met in Rosemont, Illinois. It was established by the National Association of Boards of Pharmacy and was charged with the following mission: review the existing state requirements for technician education and training requirements for national training programs, accredited organizations such as the ASHP and the Accreditation Council for Pharmacy Education Core Competencies. Recommend national standards for technician education and training programs, and encourage boards of pharmacy to recognize them. The NABP Executive Committee accepted the following recommendations from the task force. The NABP should encourage boards of pharmacy to require as an element of pharmacy technician certification, completion of an education and training program that meets minimum standardized guidelines.
That's what you are taking right now?
They should encourage boards of pharmacy to require as an element of pharmacy technician certification, completed of an accredited education and training program by 2015. And there's some more that you can read about. Quite a bit. So in 2011, the PTCB launched the CREST initiative by hosting a summit focused on the areas of consumer awareness, resources, education, state policy, and testing as they relate to pharmacy technicians. Summit participants made recommendations during the meeting pertaining to additional requirements for a candidate to sit for the pharmacy technician certification examination, which is the PTCE. The following recommendations were proposed. By 2014, PTCB should require a minimum period of practical experience to be eligible for the PTCE. So what that means is before 2014, anybody could just pick up a pharmacy technician book and pay the money to take the test, study, and then go take it and become a pharmacy technician. But with the need for more clinical and educational roles, we would rather have them do a training program or do, work in the pharmacy versus just training themselves at home. So that changed in 2014. In 2015, mandatory criminal background checks are required for all PTCE candidates. So keep that in mind. You will have a background check for your PTCE. You will have a background check for your state licensing, and you had to have a background check to be in this program. So I'm assuming you're all okay in that aspect. By 2020, all PTCE candidates should be required to complete a training program accredited by the ASHP. So as of 2020, it is officially required 100% that a training program be completed.
Okay, so we're the training program, and next semester, or in the summer, not in the summer, in your senior year, around spring semester, you'll start your clinicals. So you'll be filling your months with doing clinicals like at the hospital and some retail. You'll do like maybe 16 hours of clinical time in the hospital setting and about 24 hours in a retail setting, just to get you acclimated to the different types of settings.
By 2015, it is recommended that PTCB change the current requirements for certified pharmacy technician recertification to, so accept only pharmacy technician targeted and or ACPET and or PT designated continuing pharmacy education credits for a total of 20 hours every 2 years.
So once you're certified and you get your certification, you pass the test, say you got certified in March and you pass a test in March. 2 years from that time, you have to complete 20 hours of CE education. You can find that online. Usually you can find those if you search Google or whatnot, or you can pay for it as well.
So this actually did change. So keep in mind our book is a few years old. I don't even know when it was written because we're referring to things in 2015. But that has changed a little bit for continuing education. But obviously for your homework or whatever, use this information. Require at least 15 of the 20 hours of CPE to be provided through the state boards of pharmacy, NABP, employer accredited programs or programs accredited by ACP. The allowable continuing education hours from college courses will be reduced from 15 to 20 by 2016, and allowable in-service hours will be phased out by 2018. So back in the day, if you had taken some college courses, you could use those as continuing education. 5 hours of practical employer-based CPE may be allowed as part of the 20-hour CPE requirement every 2 years. Maintain the requirement that one of the 20 required CPEs be in pharmacy law, and require one of the 20 required CPEs be in medication safety, and that's effective in 2014. Competency can be defined as the capability or proficiency to perform a function. The practice of pharmacy includes a wide variety of settings, so we must be able to have different skills and function in each area and move from each area to another without any problems. So box 3.2 lists chapter references citing common responsibilities and competencies of a pharmacy technician. So these are all the chapters in this book. You can click on any of those and it will take you to those chapters and you can read about more responsibilities and competencies. Each state in the United States has its own Board of Pharmacy, which we abbreviate as BOP, which is overseen by the National Association of Boards of Pharmacy, the NABP. Each state's BOP serves many functions, including registering technicians and licensing pharmacists. The board also provides consumers with a way to file a complaint or report any problem or illegal actions they have experienced in a pharmacy. BOPs also review and update current rules and regulations pertaining to pharmacy practice. And when new standards are implemented, BOP inspectors may visit any pharmacy to determine its compliance with these new standards. If the pharmacy is found to be in non-compliance, the BOP has the authority not only to impose fines, but also to close the pharmacy until compliance is attained. If a pharmacy technician is found guilty of a violation of pharmacy law, the BOP can revoke his or her registration or license, depending on the state's regulations.
So Texas State Board is pretty important. They regulate a lot of things that we do. In order for us to get our trainee license, which we'll need to get in your senior year, first semester, you need to, you'll have a background check, but we'll go into Texas State Board of Pharmacy to get signed up through that. I believe that costs about $55 to register as a trainee, and also another $30 because they'll do a fingerprint test, check your background as well. They keep that on file. I mean, if you do have a felony, more than likely that'll keep you from getting your certification. There's plenty of adults that I've taught that tried to get their certificate or training license, and they got rejected because they had a felony. What else does the state board? The state board regulates everything that's making sure that we have our paperwork correct, make sure that we're filing correctly, making sure our numbers as far as controlled medications, the inventory is correct or whatnot. So they do keep track of all this stuff. If they see anything that's wrong, you'll probably get a visit from them. And sometimes they just pop up at a surprise.
The NABP and state BOPs are currently studying the expanded use of technician in the pharmacy field. For example, technicians in California who have achieved a specific level of competency are granted the additional job duty of monitoring other pharmacy technicians. In Tennessee, technicians can take physicians' verbal orders over the phone. More states are requiring technicians to be registered, certified, and/or licensed. This examination of the current uses of technicians no doubt will reveal the skill level necessary for various types of pharmacy tasks, and ultimately changes will be made by each state board of pharmacy. Boards of pharmacy also may change technician to pharmacist ratio in pharmacy settings. A knowledge of pharmacy law is essential before a person can work in a pharmacy environment. And once you're there for like a week, you're going to be hit with so many different examples of the laws. Most people will tell me, I don't know the laws, but once you get in the pharmacy, you learn them very quickly because they get presented to you quickly. So federal law governs all 50 states. In addition, the BOPs has specific laws, regulations, and guidelines that pertain to the pharmacy practice in that state. So box 3.3 shows examples of federal laws governing pharmacy. Box 3.4 shows the pharmacy technician state requirements, and it's probably changed a bit depending on your state. Technicians perform many non-discretionary duties in the pharmacy setting. These are tasks that do not require professional judgment. Examples include repackaging medications, managing inventory, filling automated dispensing machines, and billing. All of these tasks are clearly defined and should be easy to follow. This does not mean that anyone can do the job. However, because prior knowledge of pharmacy terms, drugs, and procedures is required. As job classifications in pharmacy expand, so will the level of pharmacological knowledge required for pharmacy technicians. So some basic non-discretionary skills. Typing, you're going to be typing a lot of prescriptions, so being able to type accurately and have a good speed is crucial. You're going to want to learn to proofread your typing because every time the pharmacist has to update your work, they're basically doing your job for them, so that just doesn't look good. So make sure, there's going to be mistakes, but make sure that you are checking what you typed before you send it to the pharmacist. Computers are going to be used in the pharmacy a lot. Obviously, that's pretty much what you're going to be working on all day. That's how we enter prescriptions, bill insurance, manage inventory, basically everything in the pharmacy. There will be a lot of reports and documentations, which kind of goes along with pharmacy law. Inventory management, crucial. Inpatient pharmacy usually refers to pharmacies located in hospitals or institutions in which patients stay overnight or longer, depending on the procedures they require. Most departments in a hospital have medications and supplies that are specific to their department. These are supplied by the inpatient pharmacy. Therefore, inpatient pharmacies traditionally have a wider range of stock than outpatient pharmacies so that they can provide all the supplies required for each department. For example, the labor and delivery unit stores a large amount of the drug oxytocin, which induces labor. Cancer units are going to have large amounts of morphine and other analgesics. Peds departments are going to have children's medications. Other important tasks include preparing IV medications and hyperalimentation products like total parental nutrition and performing non-sterile compounding of ointments and creams. The pharmacy loads patient medication drawers and or automated dispensing machines that allow nurses to access medications. Various individuals in the healthcare institution are responsible for proper documentation of controlled substances and floor stock disposition. However, the inpatient pharmacy oversees the process. In addition to knowing the various drug strengths and dosage form, the technician must be able to immediately and appropriately react when emergency orders are received by the pharmacy, which we call stat orders. The dynamics of an inpatient pharmacy can fluctuate minute to minute depending on the flow of patients into and out of the hospital. Stat doses are to be delivered within 15 minutes or less to the area requesting them, such as the emergency department, operating room, intensive care, or cardiac care unit.
So you'll probably see that on a exam or test. Stat doses are to be delivered within 15 minutes or less to the area requesting them. Usually
So here is
the emergency department will have a lot of stat doses. So the IV tech usually has to be pretty much on standby if they're not already in there preparing for the patient's daily meds. So they're talking a lot of work done in the hospital setting right now.
figure 3.1, preparing intravenous solutions for inpatients. Another aspect of the inpatient pharmacy is the preparation of unit dose medications, which are widely used in many hospital settings. The following are common duties, roles, and responsibilities of technicians working in a hospital, nursing home, or other inpatient facility. Most inpatient pharmacy technicians who are interested in the following areas in pharmacy receive additional on-the-job training to prepare them for these additional tasks. So if you want to expand your career outside of just regular retail pharmacy, you probably should work in a hospital because there's way more different opportunities and advancements. That doesn't mean, though, if you want to work in a retail pharmacy for the rest of your life, that's bad. Just some people would prefer different settings.
And the hospital setting will also get you ready to do IVs, make IVs, so you'll get IV certified as well. So You can carry that if you're going to move or something. You can keep that with you another certification. Of course, it helps with higher pay as well.
So we have an inventory technician who orders all stocks, handles billing, talks to drug reps, and may be responsible for ordering low-cost items. The robot filler, they're going to fill the patient medication drawers each day and keep everything running smoothly on the units. IV technician interprets orders and prepares all parenteral medications in both large and small volumes, including controlled substance drips, TPN products, insulin drips, and any other special order intravenous or intramuscular drug. The chemotherapy technician receives orders and prepares all chemotherapeutic agents and their adjunct medications, such as antiemetics. An anticoagulation technician assists the anticoagulation pharmacist in contacting patients when patient follow-up is necessary or the patient's medication or dosage needs to be changed. Technician verifiers, as a part of the tech program, this specially trained technician checks the work of other technicians, including filling patient cassettes and preparing floor stocks. Clinical technician assists the clinical pharmacist when tracking patients' medications. The clinical technician may compile important data that the pharmacist needs to monitor and evaluate patient outcomes or the appropriateness of drug therapies, or to monitor formulary compliance. Pharmacy informatics analyst, the specially trained technician, works with the clinical application specialist to maintain pharmacy software.
So a clinical technician will help you out if you're going to be a pharmacist, anesthesiologist, getting data for them as well. You know what the disease is, how long the duration of the disease, and what's working, what's not working as far as medication for the patient.
Supervisor technician schedules other technicians and may even hire prospective technicians.
So supervisory technician is more like a lead tech, set the schedule, watch over other technicians, and also train technicians.
Skills and backgrounds. So this is just a sample job description for a pharmacy informatics analyst. Working in an outpatient pharmacy or a community pharmacy setting can be one of the most difficult tasks in pharmacy because of the close interaction with patients. This job tests the communication skills and stress levels of the technicians who work with the public. This job has a high volume of interaction on the phone. These technicians register, refill prescriptions, and answer questions pertaining to various types of insurance coverage. Computer skills are often necessary to find patient-specific information and assist the customer over the phone or in person. Many neighborhood pharmacies fill a high volume of prescriptions daily. So for instance, one of my students is at Walgreens in Davison, Michigan, and they fill almost 1,000 prescriptions a day. And yes, that is a lot. So just kind of think about that. It is not uncommon for a mid-sized pharmacy to fill 300 or more prescriptions a day. So every pharmacy I've ever worked at has filled about 300 or under. I did work at one that filled about 800 to 900 a day though. So you're going to answer phone calls and address patients' problems. That's going to be the gist of your job. In addition to filling prescriptions, the outpatient technician must be able to order stock in a timely manner. And the billing of various insurance companies is another skill the outpatient technician must.
Okay. So outpatient is mainly retail setting. You have different types of outpatient settings, compounding as well. Compound is probably the funnest if you're doing outpatient, but working for Walgreens, CVS, you're going to kind of have to have thick skin because there's going to be some angry people, especially if their prescription's not ready and they're already sick, so they're already feeling bad. And so again, you're going to have thick skin. Think of the patient as your grandparent or somebody that you love dearly, and try to work with them because they are sick. So you have to show some type of empathy working in this field as far as being in the outpatient pharmacy. But like I said, compounding has been the funnest in regard to working in outpatient. Um, Not to say that CVS is great because I've had my time on CVS, and you just got to find the right feel for it. United seems to be good to work for. HEB seems to be good to work for. Um, Most of the independent owned pharmacies are pretty good to work for as well. They don't fill only but maybe 150 to 200 per day. So not too busy as far as independent owned pharmacies.
So these are some jobs performed by the outpatient pharmacy technicians. So insurance billing technician, retail technician, inventory stock technician, technician recruiter, technician trainer, and technician manager. Here's another sample job description for third-party billing rejection specialist. Closed-door pharmacy is exactly what its name implies. These pharmacies are not open to the public and they are normally based away from the institutional sites. Depending on the type of service the closed-door pharmacy provides, couriers deliver the medications to home health clients, inpatient hospital pharmacies, specialty clinics, and assisted living or long-term care facilities. The job descriptions of home health pharmacy technicians incorporate some of the duties of both inpatient and outpatient. The technicians usually are processing prescription medications for patients weekly or monthly, which is similar to the outpatient setting. However, there are no patients, physicians, nurses, or other healthcare providers in the facility. Closed-door pharmacies are different in that the oral prescriptions usually are packaged differently. Flat cardboard blister packs are prepared by technicians for use by nurses who administer the drugs in the assisted living, long-term care, and home health setting.
So a lot of closed door pharmacies do a lot of IV work as well, compounding as well. So these are for patients who don't want to have to deal with all the back orders or whatnot, or busyness of the CVS, Walgreens. So they'll go and they'll get their scripts from a closed door pharmacy where they are filled monthly, sometimes per 3 months.
Other technician responsibilities include preparing parental medications. Usually a few days to a month supply is filled at each time instead of only a 24-hour dose of medication. A licensed pharmacist checks all medications filled for a home care patient before they are delivered. And here is a pharmacy technician job snapshot. Look through that. Mail order pharmacies and e-pharmacies are growing as the baby boomers reach maturity. The need to fill prescriptions exponentially has increased as more medications have become available to treat commonly acquired illnesses specific to older persons. Large distribution centers process new prescriptions and refills. Technicians are also used in these settings. This is a relatively new area of pharmacy that is growing steadily. The growth is occurring partially because many aging Americans are living longer and are taking multiple medications that can be costly. By using mail order, they often can receive drugs at a lower cost.
So mail order you'll find in larger cities such as Dallas, Houston, San Antonio. Amazon's been on the move with that, but there are plenty of mail order pharmacies right now in Texas. If you're going to be, moving out away from Midland to a big city.
Since 1982, when pharmacy technician accreditation programs were first established, the ASHP has been the leader in providing course curriculum and standards and offering students the best foundation for becoming technicians. Before the formation of technician schools, the ASHP ACPE's training guidelines and standards were used in hospitals for training pharmacy interns. Accreditation continues to be a voluntary process under the Pharmacy Technician Accreditation Commission, a partnership formed in 2015 between ASHP and ACPE. Program accreditation is given to colleges and technical schools that apply and meet the requirements set by the ASHP and the ACP. And box 3.5 shows the ASHP model curriculum for pharmacy technician education and training.
And that's on
And they're
page.
categorized into the following fields.
That's on page 60.
Read through these. According to our standards of pharmacy program must require a minimum of 600 hours, 160 hours of didactic training, 80 hours of simulation, 160 hours of experimental training, and at least 2 different practice sites. So this has changed a little bit since this book was written. There are 4 levels of pharmacy technicians. Pharmacy technicians who have no specialized training or credentials and license, registered and certified technicians. Each level has different qualifications, which may differ from state to state. The first level of pharmacy technician requires no specialized training. A licensed pharmacy technician is licensed by the State Board of Pharmacy. Licensing is the process by which an agency of the government grants permission to an individual to engage in a given occupation. A registered pharmacy technician is a pharmacy technician who registered with the State Board of Pharmacy. So some states call it registration and some call it licensing. Registration is the process of making a list or being enrolled in an existing list. Registration should be used to help safeguard the public through tracking of the technician workforce and preventing individuals with documented problems from serving as pharmacy technicians. A certified pharmacy technician is one who has earned national recognition by the non-governmental testing agency or association. Certification indicates that the person has met predetermined qualifications specified by that agency or association. CPHT currently is the main credential available to pharmacy technicians. It should be the goal of every pharmacy technician to become nationally certified. So one thing, if you go to Meijer or Walgreens or any of those kind of pharmacies, they will probably tell you like, oh, you don't need to go to that training program. You can come here. We'll train you. The only bad thing about that is you're not going to have the ability to become national certified without taking a course. So a lot of these jobs that we were talking about, like in the hospital inpatient, they're going to require you to be PTCB or NHA certified. So it's going to be hard to move out of the pharmacy that you just got that license through. So say like you worked at Walgreens, it's going to be hard to leave there and go somewhere else because you're not going to have national licensing.
And national licensing is just basically taking the PTCE test or the NHA for you to be certified.
So box 3.6 shows the goals of the pharmacy technician certification exam and eligibility requirements. You can read through that. If you have any questions, let me or your instructor know. So table 3.1 shows the comparison of technician certification exams. So we have.
So you have the EXCPT, which is given by NHA, and you have the PTCE, which is given by the Pharmacy Technician Certification Board. These are old costs. So they have EXCPT at $105, which is up now to $125, and I believe PTCE is up to $139. They're both about 2 hours long. Frequency of testing is just continuous. Pearson View is the provider or the site, and PSI is also the provider for the NHA or EXCPT. Again, Pearson View is for PTCE. The results are available. They should be available immediately after taking the test. So you'll know if you pass or if you fail that one after you take that first examination.
The EXCEPT, which is the National Health Career Association test, and then we have the PTCE. So you can go through those and see the differences between them. Our program heavily endorses the PTCE, and that is the one I would recommend to you. There's a lot more ways to advance with that. So as of December 5th, 2013, the PTCB offers one sample exam consisting of 90 multiple choice questions to be taken within 110 minutes. The new practice test is designed to familiarize candidates with the PTC. So this is actually through the PTCB. We do offer some practice exams through Ross. So if you don't know how to access those, please let me know. We'll figure it out for you. And box 3.7 shows the pharmacy technician certification exam blueprint. So it is the breakdowns. I just want to see because it doesn't.
That's on page 73 in your book.
Yeah, this has changed. I have a newer one. If you want to see it, let me know. But the percentages have changed. Pharmacology is like 40% now.
Yeah. The outline, the medications is 40%, generic brand and classification of medications. So that's what y'all are learning right now. Federal requirements is 12.5%. Patient safety and quality assurance is 26.25%. So we'll finish out learning that out in your senior year. And order entry and processing is 21.25% of the exam. So gives you a little outline of as to what to look forward to as far as the exam.
So yeah, I will make sure that I send that. If you want, just email me dengler@rosseducation.edu, or you can go on the PTCB's website at ptcb.org and you can see the current updated information. The National Health Career Association is accredited by boards of the National Community Pharmacists Association, the National Commission for Certifying Agencies, and the National Association of Chain Drugstores. The exam administered by the NHA is called EXCPT. It is given throughout the country at various testing sites. They do have practice exams as well, 2 of them at $25 each. One of the recommendations of the 2011 CREST Summit involved the creation of specialty pharmacy technician certifications. The PTCB Board of Governors is focused on ensuring that the PTCB program prepares CPHTs for the integral roles they play in supporting pharmacists in all practice settings. Currently, the National Pharmacy Technician Association offers 3 specialty certification programs for technicians who want to enhance their skills and marketability. So sterile products IV tech, compounding certification, and chemotherapy. To learn more about.
All right. So specialty pharmacies deal with IV certification, compounding certification, and chemotherapy certification. All right, we'll finish that up this week. And again, chapter 5 quiz Friday for those who are going to be here. Y'all have a great day. Y'all have a good one. On which one? Okay, so you'll just take it. Following week.